you come into the patient's room, you wash your hands, introduce yourself, provide for privacy, and then we're going to go over and do our patient identification. So you check the patient's ID band, you confirm that with 2 identifiers, asking the patient a name, full name and date of birth, also ask for any allergies, double check that with the EMR to make sure that you have the right patient. Once you determine you have the right patient, you again are going to review the practitioner's order or prescription in the EMR. Once you verify the prescription in the EMR, then you can go ahead and also look at the patient's indication for having the IV started. And in this case, the order is for an IV saline lock that we're going to place. And it's for giving IV antibiotics and other medications. The patient is not going to have infusing IV fluids at this time. So I look at the patient's past history, medical history, and I make sure that this is appropriate to perform on the patient. I also want to make sure that the extremity that I'm going to choose for the IV is free of any circulation problems, stroke, paralysis, lymphedema, perhaps from mastectomy. So I'm just going to note all that before I choose that extremity, and I will go for the other extremity if that's the case. All right, so now that I'm in the room, I washed my hands as I entered the room, but I'm going to go ahead, I checked the identification, I'm going to lower this side rail, and I'm going to raise the bed to a working height. And I'm going to explain to my patient what I'm going to be doing. Patient has no questions, they verbalize understanding, deny any past history of having problems with IV starts. Okay, so I have my patient's extremity here that I'm going to be evaluating the veins in. And many times when we're performing IV starts, it's best to try to find a very good vein, if you can, to start that IV. It causes less pain for the patient, and the vein will last a little bit longer, especially for giving medications. I'm going to go ahead and place my gloves on. I brought all my supplies in the room with me, and I checked expiration dates on the supplies, and everything is good to go. All right, so as I look at the patient's arm, I'm noting that this patient is darker skin colored, so a lot of times you want to have bright light when you're looking at patients with dark skin. Fluorescent light is the best, but bright light if you don't have fluorescent light, because you're able to see the veins a little bit better. Okay, so I'm looking here. I'm going to grab my tourniquet out of my IV start kit because I'm going to assess her veins. Okay, so now I'm going to find the appropriate vein that I want to use for this patient. I'm going to place the tourniquet on. Okay, and then I'm going to go ahead and examine the veins. The veins in the hand look fairly good. They also have, I can feel this one here has a few bumps that might be a valve. So I'm going to go up a little bit further, because a lot of times you want to start more distal, because if you're unsuccessful, you might have to keep going a little bit up in the arm. So I'm going to go ahead and feel this vein here. And this vein feels really well. It's soft, it's flexible, it's bouncy. When I pull down on it, I don't feel any valves in this area, and I don't see any valves in that area. So I'm going to kind of put this patient's arm in sort of a dependent position, and then I'm going to go ahead and release the tourniquet, and I'm going to remove my gloves and wash my hands, and I'm ready to cleanse the site. So with the chlorhexidine, I squeeze to activate it, and I'm going to go ahead and do my cleansing. And I'm going to let that dry. And as I'm letting it dry, I'm just going to make sure that I have everything that I need. And I have my normal saline flush, and I attached it to an extension tubing. And the kind of tubing that you're going to use for an extension kind of depends on what type of IV catheter that you're using. So for instance, this one doesn't have an extension built into it, so I need to have a full extension to put on it. So I open that up, okay, and then I get that ready over here. All right, so now I'm ready to go ahead, and I'm going to wash my hands again. Always telling the patient what you are doing and explaining what you're doing. Okay, I'm going to put my gloves on here. All right, so now I'm going to reapply the tourniquet about 4 inches above where I'm going to insert my IV. Again, making sure that I'm checking the radial pulse and avoiding touching where you cleansed your site. And I'm going to remove the protective cover on my IV. Okay, make sure that my bevel is up. And then I'm prepare the patient and tell them I'm going to puncture the skin at about a 5 to 15 degree. You're going to feel a poke. Once you feel that puncture the skin, go in a little bit more and try to even out your catheter. Okay. And then we're going to release our safety, putting that over there. I'm going to grab my secure your IV, release your tourniquet, and try to get the top off of there. Okay, securing your IV, and you're going to blood return, and then you're going to flush with approximately 3 cc's of normal saline. Good. Once you have that flushed, you're going to clamp. The IV. And then you have the patient, remind the patient to hold still. And then you're going to go ahead and open up your securement device. And there's different types of securement devices, but this is a stat lock. Not always the best here on and once you have your stat lock secured on there, then you can go ahead and put your Tegaderm dressing, your clear dressing over. Okay, I'm going to remove the outer sides here. All right, and then I'm going to remove my saline syringe, keeping that end sterile, and then I'm going to place my disinfectant cap on there. Okay, and it remains clamped. And then I ask the patient how they're doing. The patient states they're doing okay. And then I make sure that all my supplies are discarded and my sharps are in the sharps container. And also, if you needed, you could put a skin protectant underneath your stat lock if you feel it's necessary. If your patient has like sweaty skin or moist skin, you can do that as well. Now I'm going to take off my gloves. And I'm going to label the date and my initials that the IV was placed. Wash my hands again. And then I'm going to put the patient in a comfortable position. Put the side rails up. Bed locked and lowered. Call light within reach. Tray table next to the patient. And then I am going to complete, and then I'm going to document everything that I did and how the patient tolerated it.